an underlying cause of severe COVID in children has been identified. Now, as we know that there is viral-induced autoimmunity, this should not be surprising. And furthermore, this may reveal why some people get severely sick from some viruses while other people do not. It may even explain why some people have negative reactions to vaccines. So let's talk about it. Hey everybody, it's Dr. David. Hope you're having a great day. So I am a board certified pediatrician in Tampa. Thankfully, throughout COVID, I never saw severe cases of COVID in any of my patients, but we know that they existed out there. Now, we also know that COVID as a whole was not nearly as severe, not nearly as impacting on children, with many of them having asymptomatic disease. But there were about 1 in 2,000 people, young children, who got severely, severely sick in something which is called MISC, or multi-system inflammatory syndrome in children. Now, why is it that some people would have this severe reaction, though rarely, yet other children, other people would be just perfectly fine? And that was always one of the interesting things that were out there. Now, one of the things that was discovered early on is that people who had low vitamin D levels, as well as low intracellular zinc levels, were more likely to have problems, severe problems, hospitalizations, death from COVID wild infection. And one of the things, as you may know in our practice, is that we test everybody's vitamin D and zinc levels from 1-year-old on. And we make sure that they have good levels and maintain good levels. And I suspect that this has a lot to do with why we did not see the same types of horrible outcomes in our patient population compared to what was seen throughout the rest of the world. Now, another thing that we also know is that some people who got COVID, it went long on them, long COVID, where they would have very severe symptoms or just troublesome symptoms, meandering systems that would be symptoms, that would be there from maybe a week or two, but could go months and months and months. That's what we called long COVID. So let's talk about this multi-system inflammatory syndrome in children, or MISC. So it's something 1 in 2,000 children would get it. And now this is considered a post-infectious. So this wasn't when the virus was actively replicating in the body. And of course, with that could bring fever and all types of flu-like types of symptoms that we saw. But this in particular is something that happened a week to 2 weeks after a person had COVID. And usually by that time, the virus was testing negative. Now, one of the things that I would start with was persistent high fevers. Most people with COVID, they wouldn't have fevers for more than 3 to 5 days. These were fevers that would go on for weeks and weeks and weeks. But also, when there was also severe vomiting and fatigue, and heart inflammation would even happen. The myocarditis, the pericarditis would happen in these kids. And some kids needed to be put into ICUs. They may have needed to be put on ventilators with breathing tubes, etc. I mean, it got very severe for some people. Now, what's happened? There has been the discovery of an autoimmune antibody that is similar to it's attacking a protein in the people's bodies, in these children's body, that was very similar to the protein chain found in COVID. Now, autoimmunity as a whole means the body is attacking itself. Autoimmunity, inflammation against the body. People have lupus, autoimmune thyroid disease. The common factor between all of them is that they would be attacking themselves, and by attacking the thyroid, it can cause hypothyroidism. By attacking joints for people who have rheumatoid arthritis or lupus, or it could attack the bones, it could be attacking the joints, it could be attacking the heart, the kidneys, all types of areas. Encephalitis, there's viral-induced encephalitis that can be another autoimmune condition as well. So what they did, and the problem is that these autoantibodies are hard to find. So again, what we're talking about are the antibodies, identifying them that we're actually making. But the problem is, since this isn't a bacteria, this isn't a virus, this isn't a nutrient for that matter. So with autoantibodies, you need to know what you're looking for in order to go find them. But you can't just easily find the autoimmune antibody, and that's what makes it really tough. But what they did discover was that there was this one particular protein called SNX8, and that's what the autoantibodies were formed that was seen in a lot of the children with the MISC. Now, it's very interesting because this SNX8 protein, it's part of the body's natural antiviral response antibodies. So normally when you would see a virus, your body would attack it. Of course, that's regular immunity. But what they interestingly found is that there is a protein on the coronavirus itself that looks almost exactly like the protein in our immune cells, in our white blood cells. And this is something called molecular mimicry. So the body sees the protein from COVID, and because of that, it gets confused and attacks the body itself. Autoimmunity, viral-induced autoimmunity. Now, one of the questions that came up is, could this be the reason why some people have vaccine reactions? Now, in this particular case, this cannot be it. Why can I say that with such certainty? It's because this protein in COVID is found in the nucleocapsid protein. So if you remember way back when, one of the ways we were able to determine whether a person had a wild immunity or vaccine-induced immunity, they would both cases have antibodies against spike protein, but only the wild disease, the natural disease, would induce autoimmunity against the nucleocapsid protein. The vaccine never carried that. So that's how we just differentiated between wild versus natural immunity. When checking people's immune system, we were able to say you did have a natural infection because your nucleocapsid protein antibody was present. Now, because of this, though, again, this can't be. Now, this doesn't mean that there can't be other autoimmune antibodies that are triggered by other parts such as the spike protein. I'm just saying it hasn't been identified. It could be a completely other protein besides those. There's lots of proteins that are on the outside of the COVID that could induce an immune response. So by no way am I saying that is, but it's certainly a plausible situation that if the natural infection can induce an autoimmunity, that a vaccine can as well. And we actually do know that that's true, because if you look at the package insert for many different vaccines, you'll see things like Guillain-Barré, which is an autoimmune disease that attacks the nerve system. It's actually often commonly triggered by viruses or medicines and vaccines. Very well established. Nobody would argue that that type of reaction from a vaccine can't happen. So I'm not saying that the Guillain-Barré is something that's naturally induced due to this molecular mimicry, but at the same time, it's something that is known as from a vaccine or medication that can induce autoimmunity. Now, another fair question: could this be causing the severe issues that adults have? Now, there hasn't been any research that I've seen. I looked to see if we could find if there are antibodies against the SNX8 protein in people, because obviously people don't usually get sick and die right away, or end up on a ventilator right away. It kind of builds and builds and builds until their oxygen carrying capacity is very diminished because their lungs are so scarred or damaged, fluid filled. Or for the heart with the myocarditis, the pericarditis. We know that those happen. We knew it happened from the vaccine. We knew that it can happen from the wild disease. So could this be part of the immune response that's happening against that, or the encephalitis from the wild virus as well? Again, not saying that it can, but this is an absolute biological plausibility. And quite frankly, I wouldn't be surprised if this is going on. We knew about the cytokine storm, right? Where some people would rev up their immune systems, would rev up their cytokines, which would create inflammation. And you need to have some inflammation to fight off the infections, right? But at the same time, might there have been an autoimmune trigger that made these cytokines go off, because that's part of the natural immune system, the fighting response. So interesting findings. I think we're going to hear a lot more about this and looking for other types of reactions. And again, maybe this will help explain more about it, which, of course, if we can find, we know that there were monoclonal antibodies that were in play that were going after the virus itself. Imagine if we could have monoclonal antibodies that attack these autoimmune antibodies in a similar fashion that can early treat or can prevent long COVID, MISC, etc. they're already using monoclonal antibodies, biologicals, for other types of autoimmune diseases. So this is not an out there type of concept. In fact, whether we will figure this out for COVID now that COVID is somewhat in the rear view mirror, of course, we are seeing a big upsurge of COVID. We're just not seeing a big upsurge of serious problems with COVID. But there's going to be the next infection around, and maybe we can figure it out. Anyways, I hope you learned something, that it wasn't too tedious on the immune lecture there. But nonetheless, I thought it was interesting, so I thought maybe you would too. Have a nice day.